I'm Margie, one of the consultant radiologists. Welcome to the channel MS Radiology. Today we're going to talk about CTPA, and I'm going to show you how I review a CTPA and go through step by step how I interpret this study. So I hope everyone's ready. So here we have a normal CTPA study, and I'm going to use this to illustrate how I evaluate this study. The first thing that I do with any study is run the study from the top to the bottom, as you can see here, and it allows me to perceive any striking pathologies. And if I do spot any, I park that. And then what I do is next go to my systematic review of the study. What's important in radiology is to review things in a systematic fashion. And you do that same every single time. It is one of the ways to ensure that you don't miss any pathology. With any study, before you begin to interpret the study, you need to assess the quality. So in the case of a CTPA, you want to evaluate whether there's sufficient contrast in the pulmonary arteries to make this study a diagnostic study. Now, I've drawn here a region of interest within the pulmonary trunk, and you can see a mean Hansford unit of 453. What we're looking for is a Hounsfield of 250 or above to ensure satisfactory opacification of pulmonary vessels in our study. Next thing is that the pulmonary arteries at this moment in time is too bright. The reason for what the significance of that is that makes evaluating for pulmonary embolus. So what I have done now is change the windowing slightly so that the contrast in the pulmonary arteries is not so bright. This is important because if the contrast is too bright, you may potentially miss pulmonary emboli. Now, the first thing that I do in evaluating a CTPA is evaluate the pulmonary arteries themselves, looking for any evidence of a pulmonary embolus. And what I do, starting from the right and then moving on to the left lung, is look for any filling defects, which will indicate a pulmonary embolus. And I evaluate every single pulmonary artery to the subsegmental levels as the quality of the study allows me to do so. What's important in me evaluating the pulmonary arteries is understanding the anatomy. So, for instance, the right upper lobe is supplied by the upper lobe pulmonary artery, which has got 3 segments, the apical, the anterior and posterior, which then splits into the subsegmental level. And in the middle lobe, you've got middle lobe artery, which has medial and lateral segments, and so on and so forth. That I look at each of these segments and subsegmental branches to ensure that they've got contrast in them, and there's no filling deep. Now that I've assessed the pulmonary artery itself, I'm going to go on to assess the mediastinum. For that, I need to be in the soft tissue window, and I'm starting at the top, so you can see the thyroid glands, and we're going on to the superior mediastinum. Anteriorly, depending on the age of the patient, you may see a remnant of the thymus gland. And as I'm working my way through, I'm evaluating any abnormally enlarged lymph nodes within the mediastinum. Posteriorly, I am looking at the esophagus and working my way down, looking for any evidence of lymphadenopathy within the mediastinum, and then I'm looking at the hilum again for lymphadenopathy. And once I've evaluated the mediastinum itself, my eyes go outwards into the axilla, and I also pay particular attention anteriorly. You can see the internal mammary arteries, particularly in breast cancer. You may have internal mammary nodes, so that's an important place to look for lymph nodes in breast cancer. Now that I've evaluated the mediastinum for lymph nodes, I'm focusing on the heart itself. And now that CT scans are getting better and better, we can see the coronary vessels, we can see the chambers of the heart itself. So in this instance of when patients are having CTPA, typically they come in with chest pain, shortness of breath. So looking at the heart is important for the other causes. We want to make sure that the chambers are not enlarged, and if we can look at the coronary vessels itself, we can evaluate to see if there is any thrombus. The other important thing that we need to assess is the thoracic aorta itself. So another differential when we've got signs and symptoms of PE is potential diagnosis of aortic dissection. So it's important that we look at the aorta. Once we've done that, another important structure to remember in the mediastinum is the esophagus, and ensure that you have a careful look at that. And once we've come down to the upper abdomen, of which part of that is imaged on a CTPA, it is important to have a look at the imaged abdomen to ensure that there is no pathology that we can see here. So we've looked at the pulmonary arteries, the mediastinum, and the upper abdomen. Next, we're going to look at the lung parenchyma itself. For that, I need to window it to the lung windows. When I'm looking at the lungs, I'm looking at the airways, the air space, the parenchyma, the alveolar airspace itself, the pleura, and the intestinum. And I'm looking at, starting on the right, looking at the upper lobe, the middle lobe, and the lower lobe of the right lung, and then moving on to the left lung, looking at the upper and middle lobe. And what's worth noticing is that you can see here you've got the oblique fissures, and you can see that the lower lobes of the lungs extends quite superiorly. It's just making a note of that. So now that we've finished looking at the airway and the air space, looking at the lung parenchyma itself and the interstitium of the lungs, I want to look at the pleura. And the pleura, it's helpful to look at it in the soft tissue window. I'm looking for any evidence of pleural thickening or effusion. Next, I'm going to move on to the soft tissues. So my eyes goes on to the surrounding soft tissue, the musculature and the subcutaneous tissue. Particularly to make a note of is the breast in a female, to see if there's any masses that we can see. Now that I've evaluated the soft tissue, the next thing that I'm going to go on to is look at the skeleton, for which I've just moved the study onto the bone window. And there is no quick way of doing this. I evaluate it by bone by bone. So clavicle, proximal humerus, scapula. Then moving on to the clavicle, proximal humerus, and scapula on the other side, looking at the ribs. And for me, I find it easier to look at the lobes on one side, evaluate the anterior ribs first, then the posterior lobes, and then go on to the other side. And then I'm using PAC-SPIN here, which doesn't really allow me to reconstruct in the different planes, but on a standard PACS unit, you'll be able to reconstruct the images into the coronal and sagittal sections. So for the bones in particular, it's helpful to look at the spine in the sagittal instance. The other thing to say is that with the pulmonary arteries itself, the apical segment of the lower lobes, there is a superior supply to that, and evaluating it in a different plane I find very helpful. And when I am looking at the lung parenchyma itself, I use MIP to help me evaluate for any lung nodules. So that is how I look at a CTPA. So I start by evaluating the pulmonary arteries itself, then moving on to the mediastinum, the upper abdomen, looking at the lung parenchyma, lungs, and the lungs I evaluate airway, air space, interstitium, pleura, and MIPing the images to evaluate for any pulmonary nodules, And then I finish off by looking at the surrounding soft tissues and bones. So there you have it. That is how I evaluate a CTPA. Okay, there you have it. That's how I look at the CTPA. What I've done here is linked you to a website, which is very helpful for learning the anatomy that's relevant when you're looking at a CT chest or a CTPA. Please have a look at that. The next video that I plan to do will be a similar video looking at how I evaluate an abdomen and pelvis. If you find this useful, please continue to support this channel by liking the video, subscribing, and sharing the content. Thank you.